We're live, sorry. Hi, everybody. Sorry, we were trying to get this figured out, but I just wanted to say hello from the Acoustic Neuroma Association. We are here tonight to talk about COVID-19 and acoustic neuroma and how we are going to deal with that. Today is Giving Tuesday now, and we really wanted to focus on that day of unity by giving and sharing information with you. So that is the plan for tonight. We are really happy to welcome several experts on acoustic neuroma, some professional and some with experience. So I'm going to go ahead and introduce everybody now. First, we have Dr. Jennifer Moliterno, who is a neurosurgeon and the Chief of Neurosurgical Oncology for Primary Brain Tumors. She's the co-director of the Yale Brain Tumor Center at Smilow Cancer Hospital and is an associate professor in the Department of Neurosurgery at the Yale School of Medicine. She performs the most acoustic neuroma surgeries in the state of Connecticut. We also have Dr. Ravi Sami, who serves as the chief of the Division of Otology and Neurotology at the University of Cincinnati Gardner Neuroscience Institute. He's also the program director for the Neurotology Fellowship. Dr. Sami has been an otolaryngologist at the University of Cincinnati and Cincinnati Children's Hospital for 15 years. We also have Dr. Barbara Walker, and she currently serves as an integrative health and performance psychologist within the Department of Psychiatry and Behavioral Neuroscience at the University of Cincinnati College of Medicine and UC Health. She specializes in the use of biofeedback and mindfulness techniques as tools for teaching self-regulation. Dr. Walker is also an associate adjunct professor at the University of Cincinnati. And then we have Emily Prater. Emily is our ANA support group leader in Cincinnati. She also serves on the Acoustic Neuroma Advisory Board at UC Health. She had an acoustic neuroma and had that removed in January of 2018 using the middle fossa approach. She continues to deal with single-sided deafness and has been an incredible resource for other patients dealing with acoustic neuroma. And we're really, really happy to welcome all of them here tonight and very thankful to all of you for taking the time on this Cinco de Mayo to talk with us and discuss this, how this whole thing with COVID-19 has really just changed everything up for everybody and kind of turned everything upside down. So the first thing that we're going to start with is a presentation, just a short couple of slides and a little talk from Dr. Walker. So I'm going to make you a presenter and let you share your screen, and you can go ahead and talk to us a little bit.
Great. Let me... Excellent, relatively seamless. Let's see if we can make that go up here. Good, okay, great, thank you. Thanks for joining us too with this tonight and hope this will be helpful. So I wanted to talk a little bit about just optimal wellness in the first place. I think that we're gathered here together today really because optimal wellness is sometimes not an option, but we have to continue to strive and figure out when we're becoming overwhelmed and when we're a little stressed, how to help ourselves regardless of that. So the idea of optimal wellness is this state in which our mind, body, and energy are operating in sync, just allowing us to truly perform to the best of our abilities and talents. Again, despite any medical conditions and things we have going on, we really want to try to strive and live life above zero, finding somehow some energy and enthusiasm to be able to rise above this. I wanted to talk a little bit about some potential effects of life-changing events. You know, for patients and their families, a lot of this comes from some research studies. And I won't read all these, but you feel this, you know, especially with this COVID-19 happening, which I know has delayed a lot of you, but it's very stressful in general, and to be stressed with a medical condition or even be delayed in that conditioning is really, really difficult. So just know that you're not alone in all of this, and a lot of people are experiencing some of the same feelings, and none of it is wrong. It is your feeling and what you're managing, and so we want to be able to help you through that. We all know what stress feels like. Just defined, it's really a non-specific response to a demanding or threatening event. It's everywhere. It's not going to go away. I feel like it's a little bit worse right now with COVID, and obviously with this, with anything that you're dealing with health-wise. We know there's a time and place for reacting. If we stay in this sort of reactionary mode, it keeps us in cave. I used to have this as a non-sexist thing, cave person mode, but it keeps us in this place of, you know, overreacting and misperceiving potential threats, feeling irritable, just staying on survival mode and feeling ready to pounce. So I don't know if anyone identifies with that, but you know, when we feel a little on edge, this is why, when we stay stressed. From a physiological standpoint, the whole stress response really starts with any anxious or negative thought we have. It triggers a stress response in our brain, a hypothalamus. I won't go through all of these things, but with the HPA axis, you can see from this, a lot of things happen when we react to stressors in our minds. And so what we want to do is help ourselves kind of slow that down and calm that down a little bit. So this all originates in our hypothalamus. But what I really want to talk about tonight is implementing some coping techniques and building some resilience that'll help you reduce that stress response. So some of the ideas around returning to baseline is important. It's really normal to react to a stressor. So a stress hormone gets involved. A lot of times adrenaline or cortisol. Over time, we want to be able to come back to this optimal level. That would be ideal. It's normal to react to a stress and then come back. But what happens, and this is a friend of mine, Adi Haramada, his beautiful slides. So I just wanted to share this. But what happens is that when we start losing resiliency, that's when we feel a little bit more worn out. So we really need to make sure that knowing that it's okay to react to a stress, it's really normal to react to a stress, but we want to be able to hit the reset button and coming to an optimal pattern as quickly as we can. The whole idea of coping is a balancing act. We know we're going to have stressors. We can all name a whole list of those now. For those of you who are dealing with some medical conditions, and especially with having to be patient and wait to get this taken care of, or to wait and see, we feel that extra stress. So we want to make sure that you have the resources to keep yourself balanced. It's when that imbalance happens and we don't have enough recovery that stress becomes a problem. So some of the things we can do, we can focus on self-care. And self-care is really the practice of taking an active role in protecting your own well-being, allowing you to find some happiness, and particularly during some periods of stress. So we want to focus on controlling the controllables. Easier said than done, and we need to figure out what those controllables might be. And we're going to talk a little bit about integrating some mind-body medicine techniques to reduce that stress. So focusing on consistent self-care, we want to make sure, and that's the bottom of the pyramid. The best thing you can do is proper sleep. That's, again, sometimes easier said than done. But figuring out a great sleep hygiene for yourself, being able to allow yourself some proper sleep. Having a good night's sleep actually includes the 18 hours prior to sleep every day, but really the hour before sleep is really important. And if anybody has questions about that later, we can talk about that. Trying to eat as clean and as least of processed food as possible. Being hydrated, at least half of your body weight in ounces in water a day. So those kind of things are within our control sometimes, most of the time. So getting exercise is tolerated, and some of that's more restorative exercise. So restorative exercise, it's not trying to hit the pavement hard and wear yourself out. We need to have some more restorative exercise. Even if you do run or do any of those kind of things, making sure that you do maybe some yoga, some stretching, even going out for some easier kind of exercise, like just some easy walking, and even walking in the woods is a great thing to do. Connecting with other people is really important. Obviously, it's really hard right now to connect with people as you had been, but it's also easy to isolate yourself when you're feeling a little out of control, but making sure you connect with others. Over the last month and a half, I've been doing a lot of telehealth and just asking people to make sure, they're doing some FaceTime calls with groups of people or just in single people, or having on your goal sheet every day, reaching out to at least one person, making sure you're talking to people, because it's easy, again, to isolate. And then trying to eliminate any toxins. Those could be, toxic chemicals that we're eating, over drinking or overeating processed foods, or that could be, I have it's kind of a funny with the energy vampires, but people sometimes that are toxic in our environment right now, if they're in your family, it's probably hard to get away from them so much. But the idea of really just paying attention to what people are helping, like you're feeling good around or you're not, and trying to minimize that time with those people. And then integrating recovery activities. Again, that's part of the rest relaxation, figuring out what you need. That could be even integrating now, if you have more downtime than normal, it could be integrating some hobbies. So, maybe picking up piano lessons or some painting or whatever it would be for you that'll help you feel good and recover. The main thing I was going to say too, in terms of utilizing mind-body medicine, I mean, this has been around for a long time, 2,000 years as a matter of fact. And mind-body medicine, if you're not familiar, just focuses on the interactions between brain, body, spirit, mind, behavior. So it's just using mind-body techniques. And it's among the most widely used integrative medicine practices among US adults. So some of those techniques are here. We're not going to talk through all of those. I'm not sure if all of you are familiar with mindfulness or mindfulness meditation. It's really allowing yourself from a mindfulness standpoint to be able to really pay attention to the present moment on purpose, as non-reactively, non-judgmentally, open-heartedly as possible. It's a great space to be in, especially if you're a person who overthinks, who worries, who is worrying, who has a hard time falling asleep, or if you know that you worry about things during the day or over planning. And so using mindfulness strategies is really helpful. And there are a lot of apps, which I'm going to talk about in a second, that you can use for mindfulness. There's some things with like pranayama breathing as well. So using your breath is really important. And I was going to, if we have enough time, could I take a few more minutes here? I wanted to just practice a little mindfulness technique that's really helpful. This is just called a 3-minute breathing space. I might do it in 2 just to kind of shorten this up, but it's a great little exercise to do if you're feeling overwhelmed, if you're feeling harried. And actually, it's a great thing to do sort of like when you wake up in the morning and then even at nighttime. It's called a 3-minute breathing space. And there's 3 steps to it, really. It's becoming really aware. So it's just pausing for a second and becoming aware of what you're doing and what you're thinking about, how you're feeling. And then it's gathering and focusing your attention on your breath. And then it's really kind of turning that back into how your body's feeling. So if you're up for this, let's go ahead and just practice this. So if everyone wants to just even close your eyes for a second so you can focus in on you. And what you want to do with this is really deliberately adopt an erect kind of dignified posture. Whether you're sitting or standing, easier obviously if you're sitting. And again, if possible, close your eyes if that feels comfortable, and just bring your awareness to your inner experience and acknowledge it, and asking, what's my experience right now? Are you feeling relaxed, impatient, patient? Asking yourself what thoughts are going through your mind. And as best you can, just acknowledge those thoughts as mental events. We have thoughts. We have a lot of thoughts that are directly, indirectly associated with ourselves. Just recognize those as mental events, just passing through. And then even paying attention to what feelings are here. So turn toward any sense of discomfort or unpleasant feelings you may be having, and acknowledging them without trying to make them different from how you are finding them. And then pay attention to what body sensations are here right now. So perhaps quickly scanning your body to pick up any sensations of tightness or bracing. Acknowledging the sensations, but again, not really trying to change them in any way. And that's allowing yourself to become aware. And then if you can redirect the attention like a narrow spotlight on the physical sensations of the breath, and just move in close to the physical sensations of the breath in your abdomen. And allow your abdomen to breathe as it expands as the breath comes in, and falling back as the breath goes out. Just follow the breath all the way in and all the way out. And when we were talking a moment ago about how we have maybe a negative or anxious thought that comes in our head, immediately we contract muscle fibers, and we start breathing with our chest. So we do a lot of shallow breathing when that happens, and that actually triggers that stress response in our body. So if you just start following your breath from in and out of your abdomen or all the way up through your chest, down through your belly, you're going to counter that stress response. And you can just use each breath as an opportunity to anchor yourself into the present. And if your mind wanders, which it will, just gently escort the attention back to your breath. And then lastly, expanding your attention, just expand the field of awareness around your breath so that it includes a sense of the body as a whole. Your posture and facial expression, as if the whole body was breathing. And if you become aware of any sensations of discomfort or tension, you can just feel free to bring your focus of attention just right into the intensity by imagining that the breath could move into and around the sensations. And in this, you're helping to explore the sensations, befriending them, just rather than trying to change them in any way. And if they stop pulling for your attention, just return to sitting, just aware of the whole body moment by moment. So think of that 3-minute breathing space as like an hourglass. You're focusing in, becoming aware. And let's see, width of the beginning of the top of the glass and coming in and really focusing on that breath and then coming back out to the body. So you can, it allows you really to get into more of a being mode rather than a doing mode. And then when you're ready, you can open your eyes. So that's just a quick exercise to be able to calm down, pay attention to what's going on with your being, and allowing yourself to think about what you are thinking about and decide whether you need to adhere to those thoughts or not. And generally we don't. So those are some examples of some mind-body techniques. And again, some of you may have practiced those. It's amazing, about 10 years ago, nobody seemed like talking about mindfulness was a new thing. And I'm hoping that most of you have experienced that at some point now. So a couple more slides here. Let me just put all this up here. So part of this is a mindful awareness of routine activities. You can take even some of this 3-minute breathing space, make it into a 1-minute breathing space, and just bring a practice into a daily attention, into daily activities. So that could be while you're brushing your teeth or drinking coffee or at bedtime, any time that calls to mindfulness during the day. It allows us to really narrow in and pay attention to what's going on with ourselves. Some mindfulness experts talk about doubling your lifespan because you're paying more attention in the present moment, which is kind of fun. So lots of studies, empirical studies are showing some real improvements in our well-being, physically and mentally, by practicing some mindfulness with regularity. And you can just do this few minutes. If you do it with some regularity, you'll see a difference in how you feel. Again, it's practicing kindness toward yourself, I like to think about practicing this as creating but not settling on a new normal. I know with any kind of health change, people talk about it's a new normal. I just like to think about not settling on it, but you're creating something new for yourself. And then finding a sense of purpose, finding space for optimism and gratitude, and then trying to get into this mindset of having some more strength, resilience, and hope. So some resources from this end. There are a few apps out, and one app that is allowing people to access it for free for 31 days is the Calm app. That has a lot of different options in it, so you could always look at that. I frequently use an app called the Insight Timer, and it has, it's a little overwhelming at first. It looks like it's going to have a premium, but you can swipe up, and not, unless you take their courses, it won't cost you anything. But the overwhelming part, it literally has like 40,000 meditations for free on there now. And they're from people all over the world that have put on these meditations, and there's music on there and just even a timer. So you're welcome to check that out. It's been really helpful for a lot of people. And I wanted to just offer a couple things. I am personally doing a virtual mindfulness meditation through May. It's Monday through Friday at 8:30. It's about 15 minutes long. If you are interested in that, you're welcome to email me and I can send you the link. There's also a Wellness Solutions virtual course that I usually do in person, but we're doing it virtually. It starts tomorrow actually, and it's from 4 to 5 Wednesdays in May. And again, that's at no cost, and it's a 4-session series. And you can come to all 4. You can just pick and choose, but I can send you the link to that too if you reach out to me. And I'm at barbara.walker@uc.edu. Again, I'm currently holding telehealth visits, and you can reach us at the number there. And another resource is obviously your local support group or this Facebook group. I'm hoping has been really helpful to you. Just continue to reach out, and then I'll stop here and allow you to ask the questions and continue this. And I appreciate everybody coming today and hope this is helpful.
Great, thank you so much, Dr. Walker. That was really, really great, really helpful. We have quite a few people on the Facebook Live tonight. We have a couple we have one person that's going in for surgery tomorrow. We have a couple that are, one person who just had an MRI, like a follow-up MRI today. So we have several different situations where people are really interested, but primarily we kind of want to know, I think, how this COVID-19 has really affected acoustic neuroma treatment within both of your hospitals. I know, Dr. Moliterno, you're up at Yale, and so things might be a little different up there than they are at UC Health. Can you start us off and kind of give us a summary of what care is looking like there right now?
Sure. So yeah, thank you, Dr. Walker. That was really excellent. In terms of care and surgical scheduling and that sort of thing, what we have been doing, of course, being in Connecticut, we're a lot closer to where the epicenter in New York was. So we have more, I guess, relatively more cases of COVID and that sort of thing. And our hospital has done a really great job in trying to prepare for the surge, which it seems that we had already been through. And now our numbers are starting to come down. So my answer would be different about a month ago than obviously it is now. A month ago, we were expecting and anticipating the surge and making sure that we had adequate PPE, which we did in the end. And so patients with acoustic neuromas, depending on the size, depending on the mass effect on the brainstem, et cetera, many of which were postponed until later, beginning this month, as well as into June. As we stand now, I think a lot of that is the same. Of course, patients who are more symptomatic, with larger tumors perhaps, or more brainstem compression, or hydrocephalus, et cetera, those, of course, have been done urgently and emergently all the while. We can talk more, of course, about what it's like, especially for that patient who's going to be having surgery tomorrow, what it looks like in the hospital. At our hospital currently, the patients who are having surgery now, they're tested for COVID prior. We were talking about this a little bit amongst our group here. At Yale, we do it the day before. And then the patients, as it stands now, they're coming in and being dropped off the morning of surgery, and there's visitation allowed in the hospital, which has been understandably hard, but also remarkably, patients have been handling that surprising to me, really well, and very understanding of that. But that's just an extra and another consideration that needs to be made during this time.
And Dr. Sami, we have a couple people who have started to get rescheduled, whose surgery was postponed, but now they've been rescheduled. So can you talk a little bit about maybe, when patients do start to come in, what is that gonna, acoustic patients particularly, what is that gonna look like at UC Health?
I think when you take a step back and you look at this, most patients are very understanding of the complexities of healthcare right now. We only did a few urgent cases throughout April, and the risk is to the patients themselves. You don't want a patient in the hospital unless they absolutely need to be there. I think beginning of March, when we were all worried about what was going to happen in the hospital, we did not know if we were going to have a massive number of patients requiring ventilator treatment. And it's amazing to me, the situation has really been fluid. What seems to be true one day or 1 week changes. And so as long as you are doing a good job communicating with patients, I've got a couple of patients in the next couple of weeks have larger tumors. Patients who are great middle fossa candidates, I'm not going to recommend that they have anything done now unless they're truly symptomatic. It is interesting, even patients who have small tumors can be very symptomatic. And in fact, some of the smaller tumor patients can have a lot of vertigo, for example. I think having that conversation with the patient and saying, hey, listen, I can do your surgery, but here are the challenges. We have to get you checked for COVID ahead of time. Right now, as of this week, we're not allowing, I'm operating tomorrow for the first time in about 3 weeks. This week, we're not allowing any family to visit the patient, and some of the patients are okay with that. If you look at Dr. Walker's slides, and I've had the pleasure of working with her over the last few years, and I think, as she said earlier, the idea of mindfulness has been really growing over the last few years. You can't look at a patient as just on the medical side. You have to look at that patient very holistically. And getting them in better shape before surgery, prehab is a great way to think about it. Whether it's mindfulness training, whether it's doing vestibular physical therapy ahead of time, you've got to have that relationship with the patient. And not every single patient, clearly, as we know, has the same needs, wants, socioeconomic status issues, educational levels. I've known Emily for a couple of years, and she's got a phenomenal support system. And so if you talk to her and how she dealt with it, that's actually could be very different from someone else. So it is nice to see that we are starting to do surgeries again. I think we take it week by week, but having that constant communication with the patient is incredibly important.
Okay, and Emily, I know you really worked hard for us today and talked to a lot of patients who were in different stages of their either getting ready to go and have surgery or different stages of their recovery. So was there one theme that you sort of heard again and again throughout the day, or did different people have different concerns?
I think no matter where the patients were kind of on the care spectrum, the common theme was the emotional toll of waiting in an environment like this. We're all really stressed out. COVID-19 is something none of us have ever lived before. So the emotional toll of waiting for treatment and waiting in this type of environment, people questioned all the time when I was calling, emailing, texting patients. They just said, what can I do? Are there things that I can do while I'm waiting? If my surgery's been pushed forward, what is the advice of the doctors and the professionals of what I can do to be more prepared once it comes time for my surgery?
Yeah. Okay. And so before COVID-19, often we would tell patients, oh, some of the things that Dr. Walker, you were talking about, make sure you eat well, make sure you exercise, make sure that you are in good health, in a good spot, before you go in, so that recovery can be a little bit easier. In some cases, we do have control over that, even within COVID-19, but in the places where, people are not able to go get therapy, how would you advise them to sort of manage that stress and that uncertainty that they're dealing with?
Yeah, and I advocate therapy, obviously, but if you can't, I don't think it's a necessity. I think there's so many resources online now. There's a lot of apps. Again, I think practicing this with consistency, and it could just be a few minutes. So it could be, if you think mind, body, spirit every day, if you could, if you start your day out with some movement, again, some good healthy food, a little mindfulness exercise, connecting with other people. If you think about just those 4 components every day, including good sleep, there's a lot of control you have over that. And I think that's going to help you be in a better place. Even with again, as redefining that mindfulness thing around literally being in the present moment, whether somebody has what you have going on right now, physically, or just life in general, we don't feel like we have a lot of control right now in a way. So it's trying to bring back this control of this moment, and then this moment, and then this moment. We're all planners and type A's, and we like to be in that space and be in control. So this whole COVID-19 thing, especially since we don't have, you can see people wanting an end date, and we don't have an end date yet, right? But being able to just be every day is the thing that maybe we were designed to be in the first place, but none of us have really learned it because we're always thinking ahead or behind, right? Yeah, so no time like the present, really, to learn some of this mindfulness. And again, it's accessible. It's accessible for free. And in fact, I probably wouldn't pay for it, on an app, because there are so many opportunities out there on YouTube or any of that. So, and if people are having trouble with that, truly, I'd prefer you email me, and I'm happy to give you some resources.
Okay. And Dr. Moliterno, we were talking yesterday, this group in general, we were just sort of talking about where the acoustic surgeries fall and the treatment in general fall sort of in the order of importance. So, and how patients should deal with that, because they are being told, if it's not urgent, like Dr. Sami said, that, that it's better to just hold off and wait, but trying to wrap your brain around a new date is difficult. So what is that going to be, where do they fall sort of in the line of importance, and how, I know you can't give us a date or a time frame necessarily, and I think it'll differ from hospital to hospital depending on the location, but how long should patients expect to wait, or where is that going to fall in the order of importance?
Well, I think that all patients should know that they're most important, and I mean that really genuinely. And acoustic neuroma patients are just as important as, the patient who I operated on yesterday and the patient who I'm operating on tomorrow, both who have malignant brain tumors. So I think that amongst all of us here, I think that's one of the main messages that we want to get across, that all of you are important, and we empathize with everybody. And I can only imagine what it's like to wait for your brain surgery and for your acoustic neuroma surgery. I can only imagine what it's like to come and be dropped off at the hospital and not have family with you. So that's why we're here. So in terms of not even calling it importance, but of triaging, I guess, because that's what we've been asked to do by our states. Our governor in Connecticut has mandated that all elective surgery be pushed to May 20th. It was May 11th, and then it got pushed to May 20th. So we're, obligated to follow that. When we triage patients accordingly, part of the triage process is always risk and benefit. And so there's, I'm sure all hospitals are similar to ours, where the COVID patients are in separate units and all the precautions are taken, and the patients are separated the best they can, but there is a very small but theoretical risk of exposure, just like there's a risk of exposure in the grocery store. So we want to minimize any patient's exposure. So that's part of the risk-benefit ratio. When we think about how we, for instance, are triaging brain tumors, as I mentioned, the cases that I've been doing just this week alone tend to be the more malignant, aggressive brain tumors that, if they were to wait a few weeks, the patient would likely have some sort of devastating neurological outcome or death, frankly. So that's kind of the criteria that we've been using and going on. And then when we postpone the surgeries, what we have been doing is using our best scientific data. And so a lot of acoustic neuromas, we understand the natural history. There's patients who have serial imaging and serial scans, so we even understand the growth rate of that particular person's tumor even better. So that can help guide us in terms of rescheduling of surgery. When we are scheduling the more elective types of surgery, which again, I would consider smaller, less symptomatic acoustic neuromas, we're then triaging based on those cases within there after the date that we're kind of opening up for more elective cases. So we're open for business. We're doing and taking care of patients, but again, we're just weighing the risks and benefits and trying to do the best for everybody.
Sure. And Dr. Salmi, how about with follow-up MRIs and things that for patients who are post-treatment, who need to come back in, whether it's a year or 2 years later, to do that? What is the priority there?
So it's interesting when you look at our facilities, how everything's become more complex, whether it's going into the ER. The danger is the number of patients that may not be showing up. Forget acoustic neuromas for 1 second. What about patients who may be having heart attacks or strokes and they're fearful? What if they're 80 years old and they don't want to go to the ER, right? Because they're thinking, oh my gosh, I've got chest pain, but if I go there, I'll get COVID. I'm not supposed to be outside. We pretty much made April urgent scanning situations only. So if someone needed to have an MRI, so I have a patient who had worsening symptoms, we're able to get an MRI for that patient to assess for growth. And I think that's perfectly fine. But then you can't have as many scans done in a day, for example, because how that room is cleaned afterwards is a really big deal. When I had clinic today, for example, we did not want a lot of patients in the waiting area. So we said no more than 3 patients in an hour. I tend to look at things, and I think when you take a step back about COVID and you take a lot of what Dr. Walker said, there's the idea of eustress, right? The idea that stress can be good. She talked about resilience. And if you said, okay, what are the side effects of this? I think one of the benefits that's been amazing is I started doing telehealth video services about 2 years ago. And I really felt like that was really important because I have patients who come in from hours away. Why do they really need to drive back to see me 3 hours one way so I can look at their MRI scan and say, hey, you're a 75-year-old person with a tumor that's pretty small. Let's continue to watch it. Now I'm having some of those patients just get their MRI scan done locally, and then it gets imported into our system. So I think there's some good out of this, and having the video visits and having us just there to support their local physician has been fantastic. So if you look at things in almost attitude of gratitude, what can you take from this? That's a good thing. I think those are some of the positive changes for patients, doctors, healthcare, et cetera.
Okay. We've had a couple questions about patients, whether it's NF2 or even just having an acoustic neuroma, maybe treatment, maybe having had radiation or recovering recently from surgery, are those patients at higher risk for getting the COVID-19 virus?
I have not seen any data on recovery for acoustic neuromas being an issue. I would say my one concern is, so I myself have asthma. I've got a daughter who has asthma. And so early on, when you looked about a month ago and said, what are the risk factors? That was one of my biggest concerns, right? Because this is something that can viciously attack the pulmonary system, attack the lungs. Now we're realizing maybe the other issues are bigger issues, such as diabetes, hypertension, obesity, heart disease, right? So if it's a younger, healthier patient and they have more of an urgent need for surgery, let's say they require a translabyrinthine or retrosigmoid approach, they have brainstem compression, you have to weigh those factors with the patient and ask them, say, hey, listen, I know these are some of the symptoms, we can still wait another week, what are your thoughts? It's not a right or wrong thing. You know, I think medicine is art as much as it is science. And unless you have that rapport with the patient, no two patients are alike, and you don't want to just rush a patient to the operating room. You have to bring that up with the patient, because I would feel horrible. Dr. Turner will feel horrible. All the surgeons feel horrible if a patient has surgery, does great, and post-op gets COVID in the hospital.
Right.
That would be just a disaster and really sad thing to see.
Right. Emily, can you talk a little bit about, let's talk a little bit about and actually all of you can contribute to this, but let's start with Emily. The environment that we're living in now, where acoustic neuroma patients, for the most part, have hearing loss. Some of them have complete single-sided deafness, and people are wearing masks. And a big part of their hearing is, or a big part of their understanding conversation is lip reading. So how to deal with that kind of stuff. And is that something, Emily, that you heard as you were talking to patients today?
Yes, definitely. And that is something that I feel like I'm living every day. Like many of our people watching and fellow AN patients, I am single-side deaf. So going out in public, there's already challenges to that in the normal world. So in the COVID-19 world, I have a mask on. The person checking me out at the store has a mask on. I'm 6 feet away from them with plexiglass in between us. So what I hear is drastically reduced from what I would normally hear, which is already half of what, you know, I should hear. So those are challenges, and it's challenges. We're already anxious about going out into public right now. Me personally, it's hard going into a store by myself because I'm so afraid I'm not going to understand the person when I'm checking out, or they're going to be frustrated with me because everybody's dialed up a little bit. Patients felt the same way when I was talking to them the last 2 days. I know in my household, this now that some places where you can have 2 family members, I'm not sure that that's everywhere, but my husband and I have what I like to call communicator masks. So they have a clear window in front so I can see him talking. And if I miss something that someone else is saying, he will always relay it back to me. But that is a big thing right now for all of us that are struggling to hear, that are, you know, at any part in this journey. So I just think that the constant communication, I think it piggybacks on everything the doctors have told us, the constant communication with other people, even if it's your ANs, you know, if it's a support group leader like myself, if it's somebody from your physician's office, if it's one of your, you know, team members from the hospital, or even a family member, I have found that just staying connected and talking about it every couple of days and just saying, oh, you know, the anxiety got to me when I went to a certain store. It may have nothing to do with my acoustic neuroma journey, and it may have everything to do with what's happening right now. But honestly, the complete connectivity of talking to people and, you know, just bouncing it off others is what's really been helping me.
And doctors, do you have anything to add to that?
I agree.
I'm sorry, go ahead.
Oh, sorry. I think communication is key, and that's just something that I think have such a good perspective on, because we certainly wouldn't know or appreciate, and that's so important. And I think it's so important to not touch your face, to not take the mask off, and and you have to be mindful of that. I mean, even everybody has to be mindful of that. So that's super important and really helpful.
Right. What I was thinking about was when Emily was telling me about some of the questions she was receiving earlier. I do cochlear implants for deaf kids and deaf adults. And imagine that, right? The idea of that's considered elective surgery, which it is in a sense, but
Right.
these patients are going to struggle. They're going to really struggle. It's very, very hard. And so, you think about acoustic neuromas, but what about some of the other surgeries we need to do and get done? There is a sense of urgency for the patients themselves. Hearing loss is an invisible disability. So looking at Emily right now, there's not a single person watching this who knows that she's deaf in one ear, right? And so I think that's often a challenge, that you have to be vulnerable. You have to be willing to tell people, hey, listen, I'm sorry, I can't hear you. I need you to speak up. And I think that's very important to do, but easier said than done, I guess.
And I think that's the thing with acoustic neuromas, is that, thankfully they're benign tumors, the vast majority, but we all know that they're not benign in what they do, or how they affect the patient.
Dr. Walker, there's been a lot of talk about, outside of the COVID-19 environment, about hearing loss and people with hearing loss and becoming disconnected because it's just difficult to go out, or if you can't understand or have a bad experience, it becomes, just easier to stay in by yourself. And now this COVID-19 is sort of piling on to that, to where that's happening to people that are not dealing with hearing loss, but are just forced to be away from others. So how would you advise patients who kind of have all of that to deal with, to make sure that they don't become disconnected, I guess?
Yeah, that's a great question. I think making sure that you don't allow yourself to become disconnected. I think it's the easy thing to do, is get in your little shell. When Emily was talking too, I was thinking that it takes a lot of confidence, right, and a lot of perseverance to push through that and feel like you can ask somebody to repeat themselves. Or I've worked with so many patients who they can't get their heads around it, and it's nothing they did to themselves, right? It's this is something that happened to their body, and they have to be able to learn that's the new normal piece of it. So working on a little bit of that confidence. Hopefully they have family members around them too that will keep pushing them, not push them over the edge, but push them to a point where they will continue to reach out. And I really mean that sincerely. Like, if you can do a little goal sheet for yourself every day, and make sure you do reach out to at least one person a day. Make sure you're reaching out to a support group. Just even if, I mean, it's more difficult now to go to the store, but even just going to the store and just talking to one person, if you're in a space where you feel kind of just isolated, it allows you, if you can even tell the clerk, like, what a beautiful blouse or whatever it would be, or, something, it lets you pull yourself out of that mode or that mood. So anything you can do to continue to connect with other people. And again, that could even be maybe even just through texting or something, but anything to connect. I think that you have to continue to connect. We are not islands. We are people. We are social beings, as much as sometimes we think that, but that's a sign of depression too, when you're really isolating yourself. Or it's the chicken or the egg effect, right? So somebody could get more depressed the more they isolate and they are overthinking so how terrible things are. And I think that that's where even for some people, at nighttime is the time where some of that negative self-talk comes out the worst, because nobody's right there to pull you out of your own head. So again, connecting, I think is the key. Yeah.
I agree. Okay. And what about, we've all gone to, we're typically used to seeing people in person, and everybody's gone to online visiting, whether it's online happy hours or online family reunions or online whatever. What other kind of online resources are available for patients, particularly ones who are maybe recovering from surgery and need, like balance therapy or something that, they're not able to get right now because of the situation? Is it better to do something like that online, or is it, should they just wait, or how do they handle that?
So I'm fortunate. I have a person that I work with, Sarah Conover. She's a physical therapist in the Dayton area. So she started back in January, pre-COVID. She started telehealth vestibular physical therapy. And so we're actually doing a study with her, because if you see patients that come from small towns, for example, having access to vestibular physical therapy is not so easy. And so I think even before COVID, this has been an issue. Some people will buy into physical therapy. Some patients want to get better on their own. I talked earlier about prehab. I really do like vestibular physical therapy ahead of surgery. And having someone, so if it's someone like Emily, who is young, otherwise healthy, and just needs guidance, she can do some of this on her own. Now, what's different is my patients who have dizziness for other reasons, and maybe they're in their 80s, maybe they're frail, or they're high risk of falling. I think that's harder to do, right? Because you don't want them doing some of these things while they're at home and falling and hurting themselves. It's interesting. One of the things I heard Dr. Walker say about the connection, I heard someone say we should call this physical distancing and not social distancing. Because they said, even though you're physically separated from one another, my parents are in their 80s, they're in Florida. A lot of people in that age group are really worried. They've had family members have already passed on. Maybe their friends have already passed on. Now you're saying to them, no, we can't let the grandkids see you. Don't go shopping, don't do this, don't do that. And I think that connection that we're all built for is so important.
I agree. Dr. Moliterno, what are your thoughts on that, on just keeping that connection and even the post-operative therapies and that kind of stuff? How does that work at Yale?
Absolutely. I think that's so important. And I mean, even I can see that with myself, because you can get so isolated just being at home and seeing patients over telehealth, or communicating through Zoom and that sort of thing. And then it's funny, because I'll drive to the hospital, that's that in the grocery store, and it's like you almost forget for a second that you're in the middle of a pandemic, because you see other people, and you see people on the street, and leaves coming out and flowers coming out, and that sort of thing. So it's so important to stay connected. From our standpoint, and I can just talk about the inpatient process a little bit as well, one thing that I was so amazed by was the fact that our physical therapists they're all still working at the hospital. Our occupational therapists, our care coordinators, our nurses, it's as if when you are in the hospital, and that's something actually I said to a patient today who I put on for surgery next week. The level of care that we're giving is not different. So you don't have to worry about that. And that goes for the surgery that's being done, and that really does go for the physical therapy in the hospital and the nursing care, and it's still the same level of care. So patients should really be reassured about that, because I think maybe I had a different impression initially that everything would be kind of shut down, and I was really amazed how everyone is there on the front line and working and helping, and nothing has changed from that perspective.
Well, and to kind of focus on that positive thing a little bit, there's been a lot of talk about, trying to figure out some good news or one good thing that's coming from all of this. So is there a part of this that patients can sort of take and find the silver lining with having to wait if they don't, they're not really in control of that? So is there, some benefit that they can look at from your perspective that might help them manage that a little bit?
I think from my perspective, I think all of us in the medical profession, I think we could say everybody just wants to do the best for the patients. And I think we're all just trying to do that. This is uncharted territory for everyone. And so we're really trying to be thoughtful and, as I said, weigh the risk and the benefits in terms of when to operate and when to have patients in the hospital. So I think the silver lining in everything in my mind would be to use this time, if your surgery has been postponed or your follow-up scans have been postponed or whatever it is, use this time to stay connected, be with your family. Not being able to see, all of your family, but FaceTime or Zoom or Skype or whatever it is. As Dr. Walker was saying, eat healthy, try to maintain your well-being, because it really is true, those risk factors that Dr. Sammy had mentioned, those are the risk factors for having complications and issues related to COVID. So trying to stay healthy, trying to stay positive and connected with people, and just knowing that you will get taken care of. You are a priority, you are important, but we're just trying to do it as safe as possible.
Okay. We're getting close to the end of our time. I wanted to kind of go around and see if anybody has any last thoughts. Everybody on all the comments and everything seem to be very positive, and hopefully this information has been helpful for people. The one question that I have, I don't know if you guys have any idea if you know of any acoustic patients who have contracted the COVID virus in either case. Neil, or
Not that I know of. Well.
Okay. Well, let's go around and just offer any last thoughts that you have. Dr. Walker, I'll start with you and put you on the spot.
Thank you.
If you're sorry. Got to start somewhere. But just give you just the opportunity to kind of offer one last thought for for patients who are dealing with all of this.
So I would say, obviously, pay attention to your breath, breathe, and create some great self-compassion. This will pass. I hope this helps. The other thing, I don't mean to be funny with this, but if you have been postponed or you're waiting, give yourself the opportunity to not only socially connect with other people, connect with yourself, and get yourself in the best shape of your life. Use this as an opportunity. That's what Dr. Sami was talking about with prehab. The better shape and better mentally and physically that you are in before you go into surgery, the better your outcome is going to be in terms of getting back to your life. So again, use it as a gift.
Great. Thank you so much.
Yeah.
Dr. Sami, you're up.
Thankfulness. I would say the more thankful you are, right? I'm thankful for the fact that this virus, well, it did devastate Italy, well, it did devastate New York City, that we're very blessed in our state and most states in the US for having as well as we've done. Thankful to all the frontline people, whether it's the EMTs, ER docs, ICU docs. I've noticed that the more you may be suffering with a condition, but there's always someone out there that may be worse off. If you have a strong faith, if you're involved with the charity organizations, it gets you out of yourself. And I would say the more you do that, the less likely you are, like just even the breathing exercise that Dr. Walker did that kept you from focusing on your state. She had you focusing on your breath and not something else. So even though it was just a few minutes, it's nice to do things like that. Focus on something other than your plight at the moment.
That's great. Thank you. Emily, what would your last thoughts be?
My last thoughts, outside of hoping Dr. Walker doesn't look in my refrigerator to make sure following her advice, is, as mentioned, the cases that have gone into surgery lately aren't our cases. So with that being said, I have thankfulness. I'm sure most everyone does as well, but you still need to show yourself some grace. This is tough. It's a hard thing to be the sick person. And if you don't look sick and people don't know you're sick, then there's an internal struggle. So show yourself some grace, stay connected. And if your surgery is being pushed, you just got a planning period that you didn't expect. If you're anything like me, I could use all the time with my litter of children to plan for any future events. So, we have, a lot of us have nothing but extra time right now. Make a few meals and put them in the freezer, spend extra time with your kids, coming up with activities, talking to your family about what it will look like, post-surgery for care, and just stay connected. And like I said, show yourself grace.
That's great. Thank you so much. And Dr. Moliterno, last but not least.
This is good advice for me personally, to be honest. I think with everyone being so positive, I'll focus on the negative. And that is, if you're upset that your surgery is postponed, that's okay. That's normal. And I'm upset that your surgery is postponed. We're all kind of thrown for a loop right now. So I do think everything that we've all been saying, to see the silver lining, and you are going to get taken care of, and you are going to have exceptional care. But if you do get those twinges of feeling that this isn't fair, or I wish it was just done, I'm tired of waiting, and that's totally and completely normal. And I, for one, certainly empathize with that. So, but you'll be fine, I promise. I really do.
That's great. Well, I can't tell you how much we appreciate having you all here, all of you taking the time to put your thoughts together and share them with us, and give us this advice, and just sort of give us an eye into what it looks like in the healthcare system right now, because I think most of us are kind of on the outside looking in, and there's just a lot of questions. So I'm sure that this put a lot of people at ease and is helpful for them to just manage, where they're really not in control. So we really, really appreciate it. I know there were a couple of medical questions in the comments about, specific acoustic neuroma things, and we didn't really touch on those. Our awareness week is coming up on May 17th to the 23rd, and we're going to have lots of presentations that deal specifically with acoustic neuroma and different, elements of surgery and radiation and recovery and mental health and all that kind of stuff. So keep tuned in, and we'll be sharing information about that. But thank you all. Thank you all so much for taking the time and for joining us tonight.
Thank you.
Thank you.
Thanks.
Thanks so much.
I'm going to be the... Barbara, I might need you to end it. I can't get it to end.
Just going to turn my light on.